What happens when a pandemic strikes a country that's gutted its public health system?
Americans getting mixed messages tonight at a time we can ill afford it.
There's so many questions about testing in the U.S.
Hospitals are reeling with New York City's mayor warning they will run out of supplies by this weekend.
Hey guys, it's Dena, and by now it's pretty obvious that COVID-19 has revealed a massive public health crisis in the U.S. But how did American public health get so bad? A big reason is that the U.S. government has continuously put profits over public health.
We've cut basic public services, and then everything else, we've assented to the system that basically says you've got to be for profit to matter.
The U.S. government's response to the coronavirus pandemic has been a massive failure. Since March, the country has scrambled to stop a virus that public health services could have helped contain. But what exactly is public health? It's all about saving lives through prevention and focusing on the overall health of the community. Think of it this way. While a doctor in a hospital may treat your illness, those who specialize in public health want to stop the illness from even happening in the first place. Things like vaccinations, testing, and tracking disease outbreaks, those all fall under public health.
When it's there, it's doing its job and it's eliminating threats before you even know that they're threats. And then when it's not there, it's failed, and all of a sudden you're dealing with a pandemic.
That's Dr. Abdul El-Sayed. He's an epidemiologist and public health expert who just published a new book called Healing Politics, a doctor's journey into the heart of our political epidemic. He also ran for governor of Michigan with Bernie and AOC's support in 2018. I called him up to learn more about what our public health system in the US is lacking.
You think about a pandemic like a fire. If you put your fire out when it's in your toaster, then it never engulfs the house. But if you wait until it engulfs the house, then at that point, you're trying to prevent it in the neighborhood.
The problem is the U.S. has often not only ignored the fire, but has taken steps that have directly made the fire worse. For example, in 2016, President Obama created a task force within the National Security Council to deal with pandemics. Sounds like a useful thing to have, right? Well, unfortunately, the Trump administration disbanded it in 2018. Key officials who left or were fired were never replaced.
I'm a business person. I don't like having thousands of people around when you don't need them.
It kind of feels like we could have used the people whose job it was to sound the alarm ahead of a pandemic. Anyway, in the US, the main federal agency that does public health work is one you've been hearing a lot about.
The CDC.
CDC just issued a stark warning.
The CDC issuing these new guidelines calling for an 8-week ban of large gatherings of 50 or more people.
But here's the problem. The Centers for Disease Control and Prevention's budget has fallen 10% over the last decade. That's right, even under President Obama. President Trump has tried to slash funding for the CDC and other public health programs quite significantly ever since he came into office. Now, the good news is that only Congress has the power to approve budgets, and so far they've turned down most budget cuts to the CDC proposed by the president. But that's pretty much the only good news. The director of the CDC has also said that decades of underinvestment in public health in the US has had significant consequences. When it comes to COVID-19, that means fewer staff and resources to do what he calls the bread and butter of public health, which include robust testing, isolating those who are infected, and tracing all their potentially infected contacts. South Korea, for example, successfully contained the pandemic using these public health practices, especially through early mass testing, something the US has severely failed at. Trump falsely claimed that the US tested more people in 8 days than South Korea had tested in 8 weeks. But the truth is that South Korea's rate of testing per capita was actually more than 6 times that of the US by late March.
The unfortunate reality is that we just have not had a federal response that is befitting this moment. And so it's left it to state and local leaders who are fighting valiantly on the front lines, trying to support their communities and protect.
But even at the state level, American public health is in deep trouble. There are more than 3,000 state, local, and tribal public health agencies across the US and its territories. Those public health departments get 50 to 70% of their funding from the CDC. And during the Great Recession of 2008, state and local departments were also cut, leaving them understaffed and under-resourced. In fact, only 51% of the population is served by a comprehensive public health system in the US. Not exactly an ideal situation when the country is in the midst of
the greatest single public health threat that we've seen in over 100 years.
Now, the CDC has gotten emergency funding that it's passed on to state and local agencies. But that's just it. It's emergency funding, a Band-Aid and nothing long-term. Research has repeatedly shown us that investments in public health save costs in the long run. So why isn't the US investing in it more? Well, turns out there's a lot of money to be made in treating people after they get sick. The medical system in the US is designed to maximize the profits of healthcare insurance companies, big pharma, and for-profit hospitals. The US spends more on healthcare goods and services than any other country in the world. It spends nearly $11,000 per person annually on treatment. But for prevention, not so much. Less than 3% of that health spending goes to public health. When you break it down, the US government dedicates just $19 per person for public health funding each year. Providing preventative public health services is a public good, which just isn't a hot commodity.
Imagine trying to sell somebody a non-thing. That's kind of what we do in public health.
Over in Europe, many countries have universal health care, and Spain even nationalized its private hospitals to help combat COVID-19. Meanwhile, in the US, both Republicans and Democrats have allowed the market to take over the state when it comes to providing healthcare services.
When you decide that something is no longer a public good, when you decide that there ought to be a profit motive underneath it, what you're basically saying is that people who can't pay should get excluded.
Using Dr. El-Sayed's example, it's clear that the COVID-19 pandemic is a fire that's already engulfed the neighborhood. So what's next?
If we don't want to be here again, then we damn well better start investing in public health. And so if the US government runs the CDC and runs our major public health institutions at the federal level, investing in them over the long term saves the US government, the American taxpayer, a lot of money. That leaves us with the potential to have better health and spend less overall than we would right now. What's lost is that CEOs at health insurance companies are not making $19 million a year, but to me, I'm okay with that.
Poor investment in public health can have far-reaching consequences. AJ Plus has taken a closer look on the pandemic's impact on hospitals in New York and across the country, and we also have a video that examines why Black people are dying at higher rates. So make sure you check out all those videos if you want to learn more.